Sorry about that. Had technical difficulties. This is Mayor Turner. It's April 6th, and I was just wanting to put out another Facebook Live and catch everybody up on where we are and what's going on. Right now in Texas, there are 7,276 cases of COVID in the state of Texas. Hospitalized, there's 1,153, and there have been 140 fatalities. Around us right now, San Angelo has 26 confirmed cases. Lubbock has 154 cases. Our sister city, Midland, has had 26 cases with 1 confirmed death. Abilene has had 31. Amarillo has 97. Odessa, we just climbed up to 29. And Wichita Falls has 47. So it is still serious. As the actions we took last week prove, closing some stores and restricting some things, it's really a time to stay home and stay safe. Just give a quick update. Many people have asked me how my mother's doing. She tested negative for the virus, and she is getting better. So thank you for your prayers, and thank you for the questions. As I talked about last week, we've been working with the box stores. That includes grocery stores, the larger retailers that are still open, to make sure that we address the lines where you're waiting to check out. That's one of the most dangerous places in the city because people were just crowding up together, which is normal. That's what we did before we had COVID. But now we are asking those stores to restrict the amount of people that can go in and to space out all of their checkout lines to make sure that we are social distancing while we are in those stores. The stores have been fantastic. They have contacted me and said, we were already working on this and we are here to protect and serve our community. So I just want to say thank you to all the box stores for everything they've done to make things better. Talking about the store closings, the clothing stores, you've seen furniture stores, the game rooms, and a lot of the hairstylists, the barbers, nail places. All those places have been closed. That was by the governor's declaration. And so what we're doing as a city is we are having the police officers go out and check. There have been a few stores that open back up. If they open up, they are subject to a $1,000 fine or up to 180 days in jail. This is very serious. We were talking about the health of our community, and we want to make sure that they're doing what they're supposed to so that we can get out of this and move on with our lives. Also talking a little bit about flattening the curve. It's something we've talked about before, but I've been given the University of Texas study. It's talking about projections, what they feel like each community in the state, how many people sick they could have, how many people that would pass away, and things like that. Also been given from the same study what they believe Odessa and Midland will go through. And these are basically an educated guess. They take the data, you take a mathematician, they put the model together, and they present the data. What they're all saying in a nutshell is, like we talked before, we don't want to be this curve. We want to be this curve. Right here is taking no precautions. School's still in, no social distancing, and the red part would basically overwhelm all of the hospitals, overwhelm all of our first responders and things like that. That's what we don't want. That's why schools are out. That's why we say stay home, stay safe. The whole thing is to keep you safe and to keep this virus from going all over the city. We're at 29 cases. Tomorrow we'll probably be over 30 cases. But right now we are only using about 14% of the machines in the hospital to help you breathe. And so we're in a good place as far as equipment. We are still looking for more of what they call the PPEs, which are the masks. But We are working on it with the state, and we're getting more as we can. Talk a little bit about stuff that I've seen around town and just kind of tell you what I'm seeing, just so you don't make the same mistake. A lot of times you'll go into a store and a person's wearing gloves. And in my stores, we use these little plastic ones. A lot of times people, they will be touching anything. They'll touch money, they'll touch merchandise, they'll touch the counters where they're working, but then they'll turn around and touch their face. The glove protects you from everything you touch until you touch yourself. When you touch yourself, it's just the same thing as you have dirty hands and you touch your face. We want to make sure that we aren't touching our faces. One study I saw said people on average touch their face 20 times an hour. And if you're touching your face and your hands aren't clean, or your hands haven't used hand sanitizer, you can get COVID on your face. If it goes into your nose, your eyes, or your mouth, you can turn positive with COVID. And that's what we're trying to protect. Also, the CDC has brought out and talked about facial coverings. There are plenty of online resources that tell you how to make them. Let me explain to you what the CDC has said. You are not protecting yourself from getting the virus. You're protecting others from getting the virus if you don't realize you have it. So the masks are good for places like grocery stores where there's a lot of people. You can make them out of a sheet, but there are some CDC guidelines that are on the web. You can go to cdc.org or .gov and get that information. That way you've got it. It'll tell you what the proper usages are, and more importantly, how to sterilize those. Using an old sheet, everybody has an old sheet somewhere that you can use and make one of those. Another thing that we really need to work on is to make sure you're getting your information from a reliable source. Unfortunately, just because it's on Facebook doesn't mean it's the truth. There are plenty of trolls out there that like to put information up that is not correct just to scare you. So if you're hearing something, maybe about a medicine, maybe about a treatment, do a little bit of research. Go to one of the national media sites, look at it there. Just because it's on Facebook doesn't mean it's correct. Talk a little bit about some people that are really underappreciated right now. And those are our nurses, our doctors, anybody that works in those hospitals right now are doing a job that is amazing. They're putting themselves in danger to save and to treat the people in our community. We are going to work on a video for the city of Odessa to say thank you to all of our nurses, the doctors, everybody in there, the respiratory therapist, x-ray technicians, anybody that works in the hospital. If you know somebody, tell them thank you. If you maybe know them on Facebook, send them a message and say thank you. Tomorrow, I'm going to come on. We're also going to talk about, tomorrow we'll be talking about drive-through testing. And the county today talked about drive-through testing at their meeting. Their meeting was recorded online, so you can go to Ector County website and look at those. And that way you can kind of understand the hospitals talked, and we're going to talk. We're also going to have a presentation to the city council, which I'm in favor of moving forward with these and getting it so that people can just drive up when they're recommended to, get a test and go, just to make sure we understand where the virus is in our community. So just heard something today, and I want to end with this. It talks about we the people. The Constitution talks about we the people. And all of those that have come before us had things to fight. Some battled world wars. Others battled all kinds of things. The way we're going to get through this is we the people. Me caring about you enough to stay home if I'm sick. You caring enough about me to stay home if you're sick. We have to keep practicing what we've been talking about. Stay 6 feet away from people. Wash your hands. Wash your hands. Use hand sanitizer. Make sure you're keeping your hands clean. And do not gather in groups other than your family. I know it's hard. I know there are a lot of people doing all kinds of online stuff to be able to talk to their friends. Don't meet up with your friends right now. We're hearing some good news nationally. Let's kind of hold it right now. We're not there yet. We have to keep fighting this virus to make sure that we don't lose anybody. I hate to hear that Midland has lost a citizen due to this virus. So each one of you are in my thoughts and prayers, and I will look forward to talking to you tomorrow. Thank you very much.